I hope everybody is ready for day 2. We've got a great agenda for you today, and one of the things we typically like to start with, especially for people who might be newly diagnosed or in the middle of pretty challenging treatment, it's nice to hear from people who are thriving in survivorship and doing well. And we usually rely on some of our folks that are really giving back to BCAN and to the bladder cancer community. And I've asked them to come and share their stories with you. So I'm very excited. Christina is here to kind of help. This is, again, a conversation. It's not a formal presentation, but I'd like to introduce you to the patient advocates that we selected to come up and speak. Our first is Alan, who is from Vancouver, Washington. Alan has experience not only with his own bladder cancer, but watching his son go through bladder cancer. And he's going to bring this perspective into the stories that he's going to share. So good morning, Alan. It's great to have you here.
Thanks.
And then to Alan's right, we have the man I call Marathon Man, Doug McLean. He is from Northwest Washington, and he was very interested when he was diagnosed in keeping his bladder because he's run over 100 marathons. So he still runs, he's still very active, and he's even participated in a clinical trial. Not only that, but he's part of that cysto trial that Dr. John Gore spoke about yesterday. He's on our advocate advisory board. So welcome, Doug. And then Gail. Gail has spent her whole life working with the research community, especially at the University of Washington. And then life took a different turn when she was diagnosed. And she still works with researchers, even though she's retired from that job, right?
Yeah.
But she's working with researchers as a member of the steering committee for our annual scientific think tank that we do every summer. We have patient advocates on that committee, and Gail is one who helps guide what is brought to the table, what topics have relevance to patients. So she's still, and again, they're all volunteers with BCAN, part of the Survivor to Survivor program, and they just do wonderful things to give back, and we appreciate it so much. So I'm going to just ask everybody to share some of their stories and, basically start out with, tell us the backstory, when were you diagnosed, and how long ago it was, and any highlights about treatments, and perhaps how did you find BCAN? Let's start with Gail.
I think everyone has a certain date or several dates that they're never going to forget. My date is March 5th, 2018. That was the first day I had an immunotherapy session. I was diagnosed with bladder cancer at the very end, just before Christmas in 2017. I was told at that point that it was cancer. They didn't know how extensive it was. After the staging operation the following month, I was told that it was muscle invasive, high-grade bladder cancer with CIS, and it had metastasized into my lymph system. So as a point of honor, being somebody who's worked in the information industry all of my life and has worked very hard to provide information access to people in law and in medical areas, I all but memorized the bladder cancer basics book. I went back when Stephanie asked me to be on this panel. I went back and I dug out all of my old notes. I want you to know that I had reams of notes. I had questions we were going to ask the doctor. I had a friend who was going to come with me and take notes, and I was all prepared, except you know what happens when you think you're all prepared. Life happens. And for me, I developed a series of blood clots so severe that I had to be admitted to the hospital on an emergency basis. and during my hospital visit, with blood transfusions in one arm, with saline in another, and with massive doses of saline going through my bladder, they asked me if I could stand up. I said, sure, I can stand up. So I stood up, and then there was this elephant that appeared on my chest. And the amount of cardiac monitoring that they managed to get into that room in a flash was amazing. So as a result of both previous conditions, coronary artery disease, which is normal for somebody who was 74, as I was at that point, and as well as some other conditions, all of which I want you to know I had ignored through a great deal of my life. When I met with the team at UW Fred Hutch, they explained to me that all of the things that I thought I was facing were off the table. So no surgery, no radiation, no chemo. In the past, the answer would have been, get your affairs in order. But luckily, because there had been a trial of pembrolizumab, Keytruda, which is what I'm sure all of you have watched on television, all of the commercials. Because of that, even though it was not a first-line treatment, in some cases it wasn't even a second line, it was the only thing that was available to me. And so on March 5th, 2018, I had my first infusion. And I was, although the odds were not good, it was a fraction of a fraction of a fraction of 10%. I was very fortunate. My system immediately responded. And when I was going back through all of my notes, I realized how much BCAN had played a role in informing me and giving me hope, because I didn't understand about immunotherapy. I didn't understand the mechanism. I didn't understand what the results could be. I certainly had no idea what the end result would be. But I went back and I looked at all my notes and found that there were answers for me in the BCAN literature and in talking to BCAN when I made a phone call to find out more information. So for me, giving back and being part of BCAN is a way of being able to give back to the community and to provide the opportunity that I so desperately loved, which is working with researchers and being able to help them communicate the results to the public.
Thank you, Gail, and it's so wonderful to have you here. And again, if you haven't already signed up for the Washington Seattle Walk, Gail's going to be there,
Any
as
one of
will
us
Andrea.
with an orange shirt on,
We can get you signed up. It's great. Okay. So Alan, you have a unique story because you had experience with bladder cancer before you had experience with bladder cancer.
I did. When my younger son, who's 43 now, was 33, he was diagnosed with bladder cancer. It was non-muscle invasive, and he was up here in Seattle, and he worked with Dr. Jonathan Wright, who was able to spare all of his body parts. And so Zach's been 10 years clean now. You know, he lives in Boise now, so he comes up here every year, just at about walk time, makes his appointment with Dr. Wright for his surveillance, and then he and I walk on the walk, and it's pretty spectacular for both of us. Excuse me. And as far as I am concerned with my story, I was experiencing these two symptoms that I typically get from an autoimmune condition that I have called Reiter's syndrome. This was almost exactly 4 years ago. It was burning when I peed, and my back hurt. So arthritis and urethritis are two of the three. The other is iritis. For Reiter's syndrome is what it's called. And I just ignore them as I typically would. You know, I would maybe take some ibuprofen and hope that everything went away in a week or two, and they usually did, and these didn't. So I went to an orthopedic guy at the clinic, and he took a look and he said, nope, can't see anything wrong with your back. Get to a rheumatologist. So I went to a rheumatologist. She didn't see anything either, and she suggested, why don't you just get a urine sample done anyway, just for giggles? And so I did, and the giggling stopped immediately. It was, they found micropapillary cancer, or I guess microscopic drops of blood in my urine, which when scoped indicated, I saw the big tumor inside my bladder. I was wide awake staring at this screen while the doctor was pushing his scope where nothing belonged to be pushed. And he goes, there's going to be a little bump, and there was a bump, and there was my bladder, and there was this great big red tumor, and he told me what it was, and I was like, I just couldn't believe that everything was fine, except I had cancer now. And so after we talked for a while, he gave me what he thought were his best diagnosis. But we had to take the tumor out, and he did that 3 days later, right? I mean, this was pretty significant. When they find micropapillary, apparently it's very aggressive, it's real nasty, and they need to move quickly. This was right at the height of the COVID also, so getting a hospital room was going to be a challenge. However, he did the TURB. I got injected with one shot of mitotocin, is that some chemical, chemo. Lasted 45 minutes, they removed it. And then 6 weeks later at OHSU down in Portland, which is 15 minutes, 20 minutes from where I live, Dr. Amling and his crew did an 8-hour surgery to remove my bladder. I was left with 6 puncture marks, right? And a couple of tubes sticking out on one side, another tube sticking out on another side, a big red thing about that big, my stoma. Everything was going well. My wife was a champ. She was with me the whole time. She really helped quite a bit. No, not quite a bit. Without her, I couldn't have made it, actually. And then for about a month, everything was going great until I started getting these urinary tract infections, right? So for, 3 or 4 days, I would run a slight fever. I'd take some antibiotics, and the fever would go away. And everybody thought everything was fine, except every 2 weeks there'd be another one, and there'd be another one, and another one, until I wound up in the hospital for 8 days, still trying to figure out what the problem was. A urologist finally showed up, stuck a catheter inside Vinny. Vinny's the name of my stoma, by the way. Stuck a catheter into Vinny, and they did a clear catch, and discovered that I've got some one of the doctors couldn't tell me. It's a kidney infection, right? Because there was a stricture about that big, apparently, in my left ureter. Urine was getting stuck here and backing up into my kidney, right? So once they figured that out, I got the joy of a neph tube. You guys know what a nephrostomy tube is? Oh man! So I had a bag on this side and a tube sticking out my back on this side. And trying to sleep was kind of a problem, Couldn't sleep on my stomach, couldn't sleep on my back. Trying to figure out what to do. I got through it. The tube lasted 3 months, but it didn't fix the problem. It just allowed my kidney to drain. And so at three procedures later, it was determined that I needed to have a resection, right? They couldn't fix the stricture without gutting me like a fish. And so I got this really cool scar running from about here all the way down to my pubic bone. Opened everything up, took everything out, rejigged the plumbing, and I've been absolutely fine since. I play racquetball regularly, except I just had my knee replaced about a month and a half ago. So, but I played racquetball regularly. I take my boat out fishing. I help my wife in the garden. I play with the grandkids. Having Vinny is just about a 5-minute problem for me every 5 days, when I change the bag. Otherwise, I go to the bathroom just like you do. I go stand in front of a toilet, take it out, open it up, empty it, put it back, and be on my way. It's really almost a non-issue. I can't say that it's been fun or easy. It's been incredibly emotional, but I'm okay. And I'm here to tell you that it's not the worst thing that could happen to you, especially with the great support systems we have around here. OHSU and the Hutch, man, they're terrific. So that's what happened to me, and I'll be happy to talk about any part of it anytime you want. I'm an open book.
Thank you, Alan.
Sure.
Okay, Doug.
Good morning. Well, like Gail, I discovered the gift of bladder cancer during the holidays. It was 2015. We were on a cruise down in the Caribbean. My two daughters and now son-in-laws were with us. And we were having a great time scootering, snorkeling. And I remember going into the bathroom after lunch. And I went to pee, and it looked like tomato juice. I mean, I literally, no pain, nothing. I was just like, wait, what's going on here? Why is that tomato juice coming out of me? So it wasn't alarming because I thought, well, I feel great, so it must be an infection. You know, it must be some little infection I picked up. So I got back to, we were living in Los Angeles. I got back to Southern California at the time. Went into UCLA, which was where I was going to the sports medicine clinic there, and got checked out, and lo and behold, bladder cancer. You know, so Dr. Chamey, if any of you know, Dr. Karam Chamey was my doctor, started me immediately on BCG. He said, this is the standard of care, let's get you on that. So I started on BCG, and it worked really well. I literally responded immediately and was fine for 2.5 years until fall of 2018, at which time we had already moved back to Seattle. We're originally from Seattle, so we moved back here. Dr. Gore is a really good friend of Dr. Chamey. They were residents together, and so I was referred to John, who has now become really a close friend. I love John. You saw him yesterday. Wonderful man. So anyway, John and I continued with the BCG, but in the fall of 2018, lo and behold, we discovered a recurrence. So as luck would have it, right at that point in time, Dr. Chamey had just started a new trial down at UCLA. And it was a new trial that had BCG with another drug called ALT-803. And it was in phase 2, so it wasn't in the first phase of testing. And so I applied for it and was accepted. So there I was, monthly trips back down to UCLA to get my installations of the new drug. So I had that drug, and again, it was successful. But 9 months later, in the fall of 2019, once again, the cancer came back. So again, John and I sat down and talked about what are the alternatives, and I told him, I said, I want to consider all alternatives that are bladder sparing for the very reasons you heard earlier, very active. And so John said, well, there's this treatment, this combination chemo treatment called gem-dose, or gemcitabine and docetaxel. Sounded good to me, and he said, you know, it could be very effective depending on how you tolerate it. So I started on that regimen, and I tolerated it extremely well. I had no problems with it at all, retaining it in my bladder, didn't have any side effects at all. Kept on that for 2 years, and then John, it was in, I want to say 21 maybe it was the January of 21 or 22, he said, you know, you've been cancer-free now, or disease-free, I should say, for 2 years. Why don't we give your bladder a rest, you know? I said, well, whatever you think. I said, I tolerate it so well, I don't care if we stay on it. But he said, no, let's give it a chance. So I went off of it, and I went for 6 months. And then lo and behold, in June of, I think it was 2022, here it is again, rearing its ugly head. So we decided, let's go back onto the gem dose, which I did at that point. And I'm happy to report, here I am almost 2 years later, and no recurrence of the disease. So I told John, we were talking yesterday, he said, maybe we should give you a chance to, and I said, nope, we're staying on this. I said, no, we're not doing this, you know. And so I said, I'm happy to do this literally the rest of my life if I need to, because, you know, I go in, just so you know, I go in once a month. It's 2 drugs. You put the first one instilled into your bladder, just, you know, it's not systemic. And I retain that an hour, and then I discharge it, and I put the other drug in and keep it for 2 hours, and then I discharge that. And that's literally what I do once a month. And then every 3 months, a week from Monday is my next one, I go in for a scope, because, you know, you want to go in and make sure that everything looks good, which it has. So I'll go in, like I said, a week from Monday for my next checkup, but that's my story.
So Christina, these are 3 very different stories. But do they kind of capture the general character of patients that you see? You know, what are some of the unique things or common things?
Yeah, well, good morning, everyone. So good to see everybody again from yesterday. And thank you for your stories. I think we've had such a fantastic sequence of presentations yesterday, and I think the survivorship kind of tied it together at the end, and now we are seeing some real-life examples. I think it really underscores everything we talked about in the sequences yesterday, the resilience, the complexity of the disease, the different disease stages, that we don't have one hat that fits all, yet we have this common denominator that all of you experience to some capacity. And the journey, the length, and the invasiveness of this cancer. Being in surgery, I very much would be the person you'd be dealing with, outpatient. But I think being on the surgical side of things, I also have the privilege to work with our medical oncology colleagues who are just on the other side of the hallway. So I feel like all of our patients are sort of a combination of, they either graduated from medical oncology, from systemic therapy, coming to our surgical side, and potentially go back to immunotherapy if they need to. And I probably interface the least with patients like Doug, thank God, because fortunately or unfortunately, most patients get to our services when there's either muscle invasive disease or non-muscle invasive that no longer responds to any kind of intravesical or systemic treatment. As far as surgical complications, I always feel like the first 30 days, it's like our patients are on a banana peel and I'm there to catch you, sort of. But the first 30 days is very, very complex post-surgery. Strictures, which some of you might have had, they are a very unfortunate potential complications of surgery, and there's really no easy way to fix it. And the surgery you went through the second time, they're huge and very, it takes a lot out of everyone to get to a point where you're back to full recovery. So.
Okay. It's not a fire drill. It's not a fire drill. Okay. Well, I think this is really clear. I mean, and what you were saying is so important, too, that brings to the point that bladder cancer is a multidisciplinary disease.
Absolutely.
Some people will do just fine with just their urologist, but at some point, maybe the medical oncologist needs to be brought into the picture. And then, in some patients' cases, they're more advanced when they're diagnosed, and maybe the urologist isn't really playing a role at all for the most part, but the medical oncology team. So it really is bringing in everybody, and again, having somebody like you on staff who can help navigate the survivorship aspect of it is so impactful. So this is great. So I wanted to just talk a little bit about, that when you were first diagnosed, who did you tell? How was that like explaining to your loved ones that this was what was going on? Or what worried you the most about your diagnosis, Doug?
So I think I had a bit of an advantage. I say that because when I was 54, I was diagnosed with prostate cancer. So that was the day of reckoning, I guess, at that point, because that was the big C showed up in my life, But I pulled through that just incredibly well. I went through the robotic treatment and literally had no side effects from that surgery. And so having gone through that experience and seeing the results, I guess when I got this diagnosis, I went, well, here we go again, just another challenge in my life, and we'll get through it. And so for me, it really wasn't the shock that I guess that initial cancer diagnosis is in your life. And that's just the way I choose to view it. It's a challenge. It's nothing that I could have predicted or changed. I just have to deal with it. And so when I heard it, I said, let's go deal with it. And that's how I approached it. That's how I approach it today.
Alan, how about you?
Yeah, I think pretty much the same as you, Doug. I was, told what the diagnosis was, and initially I was just flabbergasted, completely shocked. I sat there and looked at the doc and like, what are you, nuts? I don't have cancer, I'm healthy. He goes, no, actually you do, and here are your choices. And he said, 3 choices. You could do nothing and you'd be dead within a year. You could start chemo and BCG and the other treatments that we have for you, But because the variant you have is so aggressive and so bad, you know, it's probably going to come back. And your other option is to have your bladder removed, and that's what I'd recommend. So, you know, I said, I'll talk to you tomorrow. I went home, and of course I spoke to my wife. You know, we talked about it, and she was 100% on board. You know, get your bladder removed. We'd like to have you around. So I did. You know, it was pretty straightforward. I'm still pretty shocked occasionally. You know, I stand in front of the mirror when I get out of the shower sometimes, and I look and I go, what the hell happened? You know, what is all this shit on my stomach, you know? Oh my God. But, you know, that only happens occasionally now. It used to happen every day, but now it's only occasionally. So, you know, that's how I deal with it. You know, I giggle about it when I can. If you can't keep your sense of humor about this, you're just going to go right down the toilet. I mean, you got to giggle. If you can't laugh about it, you're in trouble, I think.
What about you, Gail?
When I was first told that I had cancer, I took a deep breath. I told my family, but waited to hear what the extent of the cancer was. When I was told that it was muscle invasive CIS, high grade, and it had metastasized, everything that I thought I knew I was prepared for totally went out the window. I was not prepared for anything. So it was a great emotional shock. And it also meant that I had to confront my health in a way that I had spent 74 years at that point ignoring. So it was a bit of a shock to the system. And after I got to the point where I was more comfortable with the fact that I could say the long list of things that were wrong with me, I realized that I had never heard about bladder cancer. And I thought, I need to tell everybody that I have bladder cancer. I've spent an entire professional career making information available to people and seeing the impact that having an informed group of people make decisions about their own lives, and how empowering that is, and how much it meant to me to be a part of it. So I figured I'm going to tell everybody I have bladder cancer in order to be able to have them become far more aware of the opportunities they have for treatment and the immediacy that they need in obtaining that kind of treatment and being an active participant in decision making.
And I think that's really something that you're hearing a lot of right here with these three wonderful patient advocates. Christina, do you see a lot of patients when they come in to see you, are they empowered to speak up, or are they either too scared or just not ready to take control? How do you encourage them to drive the journey that they're on?
Yeah, I think I really like how you frame that, drive the journey. I feel like I'm a sort of a guiding light in the road and there to help you, and really be sure that, as some of our friends said it last night, to treat you holistically as a whole person. You're not your diagnosis, right? Where people are at, I think it's sort of an art when you are a clinician to kind of tap into that, because we have patients obviously coming pretty far to UCSF. Some of them drive 6 to 8 hours just to come down for a visit prior to surgery or installations or immunotherapy. So I think in some of the initial visits, my goal is just to really get to know you. Where are you? How can I help you best? Although it sounds, simple, but I feel like it's a whole family affair having this particular diagnosis and journey. As I mentioned yesterday, a lot of the patients get to me, they are maybe a month or two prior to cystectomy for the most part. And we have a fairly well-oiled clinical pathway at this point. Patients get their pre-op material, which is very thorough. They get their ostomy kits. Even if you want to opt for another diversion, it's like I'm playing the devil's advocate. Like, are you sure that's what you want? I always tell my folks, I'm like, this is like a bad divorce. So think about it really thoroughly. Are you really wanting that neobladder, or do you really want that Indiana pouch or whatever else? Because we really try not to touch the ureters again for lots of reasons. And so ideally, when I meet you in clinic and your family, you actually put your hands on that ostomy box. You actually read the material. We have a very nice PowerPoint presentation with our nursing team, so you have a general idea. And I can tell you, at this point, if actually during this visit, somebody tells me, I actually looked at what you sent me, I'm shocked. Because the visits, if we are really talking about how visits should go, it would be so much more informative and easier to talk about these things, but that almost never happens. People get their kids, they throw it in a closet, they kind of eyeball the material, maybe not. And so it's really kind of one step at a time in these visits. And whatever we get through. I expect people maybe retain about 20% of what we talked about. And over the years, lots of questions would be coming in a day or two before surgery, to a point where I was about a year ago on the phone with a patient Dr. Porton was about to operate on at like 9 in the morning, 4:30 in the morning. I'm on the phone. Her husband's driving, and she's crying. She doesn't know what she wants, right? I'm like, oh my goodness, this is challenging. So I started to send out telemedicine tickets at the time of my visit when I'm closing it. And I tell patients, this is for you to use or not to use. If you have questions prior to surgery, we can jump on Zoom one more time, spend as much time as you need. If you don't need to use it, wonderful, just have it in your pocket. So.
This is great. So I think it's really up to you as a community to speak up. And sometimes you need a sidekick to help, because when you're in the doctor's office, 4 ears hear better than 2. And especially if you're gobsmacked by the diagnosis and everything else and what is about to be presented to you as options, it helps to have somebody else. If you can bring somebody, a friend or family member with you, that certainly makes a big difference. Let's talk a little bit about some of the hiccups, the challenges. Now you guys have been doing this for a little while. What happens when you have a hiccup in, a side effect or something? How do you, we're supposed to be able to report all these things so that the doctors know how to manage them. But, when you're experiencing them, do you feel comfortable knowing what you're supposed to bring to the doctor and share with the doctor? Or have you had any experience with hiccups on your journey, your potholes, as I like to call them sometimes, that cause you to veer off course a little bit? Maybe I'm being too weird here. I don't know.
I think I've been fortunate, number one. Let me start there. I think that my potholes have been very manageable. They've come up because the treatment stopped working. But as I mentioned earlier, I'm just very pragmatic, and just John and I sit down, talk about it, and say, what are the alternatives? And I just want to take a minute to say that's what's exciting about bladder cancer right now. There is so much going on. And probably a lot of you have seen me at other conferences now. I'm very involved in the bladder cancer community because of that, because it's so exciting. There are so many new things that are coming out. I think Dr. Petros Grievous is going to be talking about that a little bit later, but it's truly an exciting time. And so for me, I just look down the road and I say, well, if this treatment will last this period of time, there's probably going to be something around the corner, coming up. And so I think that's what keeps me optimistic, excited about what's going on in this particular area right now in medicine. So like I said, the potholes have been very manageable for me, and there'll be more, I'm sure. And I haven't had any side effects, so you asked about that. I've had no side effects, so it's been great.
So when it came time to choose a clinical trial, because that's an unknown.
Right.
So what was your process for thinking about
Well, thanks for bringing that up. I was saying this morning to a couple I was talking to that I think it's a disservice to refer to these things as trials.
Yeah.
Because it scares you. It goes, oh my God, I'm in a trial. What happens if it fails? You're really not in a trial. You're really on the cutting edge of the newest treatments out there. You should be honored. You have to be selected. I had to qualify for the trial. It isn't like I'm just going to be, oh, okay, I'll agree to do that. It isn't that way at all. You have to qualify and participate in it. And I felt so fortunate to be, I've been in 2 trials now, because the standard of care I got, I would say, is easily double what your normal is. Now, this isn't the sugar pill trials. These are trials where you're going to, at a minimum, receive your normal, whether it's BCG or whatever you're on, and then you get another additional drug. Like in my case, it was this Alt 803. So, again, I would lobby to change the word trial to opportunity. It really is an opportunity to enhance your treatment. And so I encourage everybody to participate in trials.
Great. Any other potholes for you?
Potholes, oh
I mean,
boy.
obviously, having to go back in was a big pothole.
That was huge. and you know, it slowed my recovery down significantly, as you can imagine. The doctors told me that anytime I get a fever, I need to monitor it. And fever goes up by 1.5 to 2 degrees, I should get to the ER, because it means some sort of infection, which could be very dangerous for somebody like me. So I live with a thermometer right by my table, you know. I mean, seriously, anytime I feel a little bit off, I take my temperature, and it's normal. Usually it's absolutely just fine. There have been a few times where it's gone up, and I call the doc, and they go, don't worry about it, it's okay. Every time I empty the bag, I see mucus, right? And the first time I saw mucus, I freaked right the hell out. You know, what is that stuff? Nobody told me about that. And, you know, so I call my doc, and he says, oh, yeah, well, that's just mucus. Well, that's okay for you to say. I don't know that.
Would have been nice to know.
Yeah. And periodically, I would get these little red scab-like things that would flake off from somewhere and get into my bag, and when I empty the bag, I see blood. I go, oh shit, blood, no. And it turns out that that's apparently perfectly normal, and I just saw a few this week, you know. I go, wow, that's unique, because I haven't seen them in a while. And I think that's a result of upping my workouts, you know. I was just cleared by my knee surgeon to start pushing myself a little bit, so I have been. And so I think that's an offshoot of that. But other than that stuff, I don't think there have been any potholes. You know, I get an occasional leak if I'm not real careful about how I attach my bag, but those have lessened over time because I got real good at doing this now. We were in Mexico recently for the second time I've traveled in 4 years, and I went swimming in the ocean. I go, oh man, this is gonna, like, everything's gonna fall off, but it didn't, you know. So I was worried for nothing, and I look at that as a pothole, as you call it, you know. My life is fairly smooth these days, and for that I'm very grateful.
Good. Gail.
When you go in to see your doctor on a regular basis, in my case, the oncology clinic at Fred Hutch UW, they would always ask me about side effects. And my normal reaction was, oh no, everything's fine. Maybe a few, you know, dermatological little bumps that are itching, but everything is fine. So for somebody who had managed to ignore their health and take it for granted for many years, I followed that pattern with immunotherapy. I was on immunotherapy for 4.5 years, until I discovered that there is an unusual, if not rare, side effect called immune-mediated colitis, which required emergency admittance to the hospital and an 11.5-day stay in the hospital, with my doctors all perplexed, trying to figure out what was going on. Was this a bacteriological problem? Because nobody gets this after 4.5 years. After 4.5 years of having no problems with immunotherapy, all of a sudden you find yourself on the extreme end of colitis, which is not a lot of fun, but they figured out that yes, this is indeed one of the side effects. I think the lesson for me is that you can't, just because things are going well, you can't ignore what possible side effects there are, and to be vigilant and to not just slough off any question, well, how are you feeling? Are you having any side effects? It's really important, not only for the medical field that you're dealing with to be vigilant, but for you to be independently vigilant, and also to ask those people who are around you to see what they notice about you.
So we have a little bit more time, so I just wanted to switch gears a little bit and kind of talk about some of the issues we addressed yesterday, kind of the mental health, body image, even, however much you feel like sharing about sexuality, all those other issues that kind of go along with this diagnosis. There's just so many elements, and again, I hope that you see that you are the one driving on the journey. This is your journey. It helps to bring a companion along with you for support, and there's great rest stops along the way in resources at your institutions of allied kind of programs that could help you in some way, but not everybody has access to all of that. But in terms of some of the topics we talked about yesterday, have you accessed other resources on your own or through your institution that have helped you on your journey? Who wants to go first, Doug?
Yeah. So I guess the short answer would be no. But yesterday was fantastic. I really enjoyed the whole mental health, and it really makes you reflect on how you deal with it and how you deal with your life. And I was thinking, in some ways, getting bladder cancer was a blessing, because it really makes you sit up and prioritize what's important in your life. And I would say that, we get cruising along, we got so many things going on, whether it's your career or activities or whatever, and you just sort of don't appreciate the day, your family and everything else. And I think for me, it really woke me up and said, you know what? Life isn't forever. Let's prioritize what's important. And I felt that's what helps me thrive, is because I have a greater appreciation now for my family, my wife, everybody around me, this community. I absolutely love BCAN. Stephanie knows this. It's just, it is family. It is so incredible. And I wouldn't have all this were it not for bladder cancer. And so, I think that's the way I choose to deal with bladder cancer. It's an opportunity. I'm going to make the most of it and enjoy my life and not be stressed, not be depressed and the things we heard yesterday, because I choose not to let it get to me that way. So.
Sorry, I was just wanting to say that from a visit or a clinical perspective, I think my goal is when I see you in your survivorship visit or follow-ups, because people are so overwhelmed, especially at the beginning, I call them planting seeds. And so, do I want to bombard you like, oh, you should see a psycho-oncologist because I think you're really depressed, or, so I bring up the different services we offer in a very gentle way, and I go back to it, like, how are you doing? Should we set you up with someone who's actually really well-versed talking about cancer diagnosis? Or you're really young, I really think maybe you should talk to one of our genetic counselors because I'm worried about your son. Same thing about, for example, mucus coming out of your ostomy. So I think in these pre-op meetings, which is at this point is a full hour to you and I get down and dirty of what's coming up, I don't want any surprises in these visits, and I want you to feel empowered. And the infections, which is the bread and butter of the urostomy. So I think the seed planting, and especially for men with erectile function, that is really challenging. So we just keep coming back to a lot of these topics as time goes on.
Well, excuse me, this has been just an incredible emotional experience for me. going through this, I would not wake up, but I would be sitting in the living room sobbing all of a sudden, when I first was right after surgery, just like that, for no reason at all. And that lasted probably for a year. I'd just break out hysterical crying, couldn't control it, and just happened for what I thought was no reason. And it's gradually sort of decreased in its intensity and in its how often it occurs. And I got to the point where I went and saw a counselor for my emotional stability, and I don't think he helped very much, so I only saw him maybe 4 times. So that's the emotional aspect of it. I still feel weird, periodically I just start crying. And I really can't control it. As much as I want to, be like Doug and say, I'm making a choice here to be happy, and I am, but sometimes there it is, just it's right there. You mentioned sexual function. I don't have a prostate anymore because it's almost an automatic, I think, Doc. They take your bladder out, they take your prostate out, and they found prostate cancer and they found CIS in there. And at the time when I was talking to my doc online, because this was during COVID, we weren't allowed to see each other personally, he was sitting there and discussing with me what my options were. Excuse me. And he said, oh, and by the way, if you're sexually active and you want to stay sexually active, we can perform nerve-sparing surgery on you, which will allow you to still get an erection and still have sex after we remove your prostate. And I go, really? He goes, yeah, absolutely. So, okay, I'm in. Sign me up. So the surgery took a little longer, I think. It was an 8-hour surgery, robotic surgery. And but I take 10 milligrams of Cialis every day as a maintenance dose, and I'm smiling, and my wife is smiling. So that's good, right? The other thing I wanted to mention, I forgot to mention earlier about the emotional impact. I was a college professor for most of my career, and I also was a TV producer, and so I traveled all around the world, and I know people pretty much everywhere. And we lived overseas for 6 years. So I have this large group of friends that I'm still in touch with, former students who are very well known in the TV and film industry and behind the scenes. And so we have a Facebook group. And I wrote to them and I told them what happened to me or what was happening to me. And I got the most incredible responses from people I hadn't seen in years, but we kept in touch, in writing. And it was just very heartwarming and very... made me feel really good that people cared enough to respond back. And so I'm still in touch with them, and periodically I'll get messages from people I haven't heard from in 2 years. How you doing? There's a guy here, he's an editor in Seattle, and we were going to get together for a beer, but he had a last-minute emergency edit session, so we couldn't. But he was a former student, he's in his 50s now, which just freaks me right the hell out. My students are grandparents, and but that outpouring of support was really helpful.
And I know, Alan, you touched a lot on what Dr. Walcott was talking about yesterday. Grief is a good thing. It's okay to grieve and address that, and just to keep it bottled up or to put it in the cupboard. At some point, it can come out of the cupboard. It helps to process and go through all of that. I think it's really important just to make sure you're doing the best for yourself. So getting outside help, talking to somebody is never a bad thing. And sometimes you do have to shop around to find the right person to help you through that journey. But usually the oncology social work department is usually really helpful. This is what they do, what they specialize in. How about you, Gail?
I found yesterday's session particularly important because he was talking about grieving, and I realized that I was grieving over the job my career that I had invested so much of myself, all of my creativity, all of my energy in, and that if I wasn't going to have my career, what was I going to have? And I think it was being involved with BCAN that gave me an opportunity to say, there's another way that you can use that commitment to information. There's another way that you can use the passion that you have for seeing research results. There's another way that you can reach out to the community and find new friends. And so I felt that I had developed a sense of reliance on myself and a sense of recovery. And I have to say that the support that I received, the encouragement that I received, the kindness that I received every time I went in every 3 weeks to the oncology department and to receive my treatment really meant an enormous amount to me. A great deal of it was during COVID when I wasn't seeing anybody else. So for a lot of that time, the only kindness that I saw on a face-to-face basis were the people at Fred Hutch who were concerned about me and wanted me to be involved in the activities to support bladder cancer on a national basis. So I greatly appreciated that connection that was fostered.
Stephanie, can I add something?
Yeah, please.
I'm a survivor volunteer, right? And over the last maybe 2.5, 3 years or so, I've spoken to several dozen men, guys who are just like me, and we've developed friendships, you know. One guy lives in Portland, and we have lunch together about once a month, and we just, you know, hug each other and talk about what's happening to us, and so we're friends. Another guy he had his surgery a week later than me in the same hospital with the same medical team. He lived in Bend, Oregon, and we would get together online regularly, and we shared the most intimate details of our lives with each other because we had that connection, you know. And he moved down to the Bay Area, but we still talk to each other, talk in quotes, probably every other week, you know. And I would say that there's 6 or 8 guys that I'm in touch with on a regular basis, even if it's just checking in, how you doing, what's going on with you. You know, I get Christmas messages from several of the patients who are now friends that I spoke with as a volunteer. And if I can suggest to those of you out there that are looking for something to do, get in touch with Bernadette Fitzsimmons and, you know, see if you can volunteer. It's really a terrific experience.
So what I'd like to do, we have 5 minutes left, which means we don't have any time for Q&A, but everybody's going to still be here, so you can go up and ask them individually. But I want to end and ask you each to just share, what does hope look like for you? What would you like everybody else to know about hope in bladder cancer? Gail? Hope? Hope.
As strange as it may seem, I think it makes you a kinder person. I think it makes you recognize the resilience that you have within yourself and to be able to then share it with other people, whether it's through Survivor to Survivor or organizing a walk or simply reaching out to people and talking about your experience. I think that there's a great deal of hope that bladder cancer brings.
Thank you. Alan?
I guess getting a bladder cancer diagnosis is not the end of the world, you know. There's lots of living to do if you have a good support group and a good medical team, and you know, life goes on, man. I'm doing fine, and I look forward to as many more years as I can.
You know, the message I would leave is embrace your disease. I mean that. I mean, go out and really get involved. I am so involved with my doctor. He even changed a protocol because of my involvement, and it was just a quick story. Is the installations I get, you would have to leave the first chemical in an hour and then the next chemical 2 hours. I'm just too busy, so I just said, you know what? And they would make you lay there for those hours, you know. I just said, put it in, put the drug in, take it out. I'm going to have lunch. I'll see you in an hour. Set my alarm, come back, get the other drug, and I'm on my way. He says, Doug, we never did that at the UW before you. Now we do it for everybody. Everybody can come in and do that. So that's the kind of involvement, the kind of things we can do with our caretakers, our family. Just embrace your disease and really, get involved with it. So.
Christina, what advice do you have?
Well, as those of you who were here last night, and I shared some of my personal grief story, I think I was really able to take a step back and connect with my patients in a way that not many clinicians can, from going through, so much trauma in my life as well. It has humbled me in ways that I never thought possible, but I think also from a clinical perspective, I get very attached to my friends, and so it's also can get pretty heavy from a human angle of things. I always tell the people when I see them in visits or together with Dr. Chu or Dr. Porton, you have an incredible team. People don't know that. You're scared. You don't know, did I pick the right surgeon? Did I pick the right institution? What's coming up? So I really try to break it down like this is chapter 1. You have a fantastic clinical team. Whatever resources you need, we will be there to provide it as long as you and I communicate. And if you have a little bell go off in your head, like something's not feeling right in this visit, or this doctor's too fast with me, or listen to it, because there are phenomenal people out there who are really able to provide amazing care.
There's lots of exciting things you're going to hear this afternoon about the new discoveries with Dr. Chu and Dr. Grievous and Diane Qualley. I think that's really inspiring. We're going to take a 15-minute break, give you a little appetizer for what's coming next in nutrition. So we've got some foods from Cook for Your Life out there, some snacks, just a little hummus and stuff that maybe you haven't tried before. And then we're going to come back and talk about nutrition before we go have lunch, which will be recipes from Cook for Your Life. Thank you all so much.